Hi, my name is Haley. I have a mother who has stage 4 high-grade transformation acinic cell carcinoma. I am making this video to act as advice and a source of comfort for anyone who may be going through something similar. Coping with a new diagnosis as the adult child of a parent or mom or dad or parent figure that you love so much is really, really hard, and it's really scary. My mother was diagnosed when I was 25 years old. She was diagnosed in October 2023, and she is alive. I should say that my perspective is from one of an adult, a young adult, but an adult. So if you are a child watching this, I first and foremost want to say I'm so sorry to hear about your mom or dad's diagnosis, but also my perspective is only my perspective. You might not be able to relate to this if you are not an adult. Before we start talking more about this, what I really want to say is that there is hope, even with a really scary prognosis and diagnosis. My mom's prognosis was a week when she was diagnosed in October of 2023. She was given as little as 9 months to live, and I still remember that day. I lived in Minnesota at the time, 1,500 miles away from my parents' house, and I was in line at Chick-fil-A at the drive-thru, and my dad called me and said it was urgent, so I picked up, and I still remember that feeling. It was like the world closed in on me, and I was just sobbing so hard in line at Chick-fil-A in my car. For a little bit of backstory before I start kind of talking about what it's like to be a child caregiver, I'd like to share a bit about my mom's journey. 2 weeks after her diagnosis, due to the high-grade transformation attribute, that means it's a very fast-moving, if you don't know. She had a 12-hour surgery that included a tumorectomy in the parotid gland, salivary gland in her jaw where the cancer was, and complete facial reconstruction on the right side of her face because the cancer had spread into the nerve system, going like here, 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 here. It was a really scary day. Yeah, that was a really bad day. But she survived, and they got all the cancer out, they thought. Before the surgery, they did a full body PET scan, and the cancer had not metastasized, but we later found out the cancer did spread between the 2 weeks between the PET scan and the surgery, unfortunately. So then she started chemotherapy and underwent 2 of the most difficult chemotherapies in existence. She did 3 total. One of them was a bit easier to handle. After her second or third chemo dose, she had a pulmonary embolism, and she will take blood thinners for the rest of her life. She survived it, but it was very scary. I should say that throughout all of this, I've been her primary caretaker, and I have spent so many days in the hospital with her. I would do it all over again, but it has been very difficult at the same time. Unfortunately, the cancer, we just found out this past Monday, the cancer has returned to her face, which was devastating to hear, and it's in her facial nerves again, the ones that were completely reconstructed with donor nerves. There's no chance of doing surgery again, but the oncology team thinks that targeted radiation can treat most of it. She was admitted to the hospital the same night we found out she had cancer back in her face. That was because the nerve with the cancer tumor on it was pressing into her eye and sinus on the right side, and she was vomiting all night long and sobbing from the pain, unfortunately. Again, that's something I stayed up all night with her and stayed all day at the hospital with her, and I was up for about 40 hours before I was able to go home. She was in the hospital for 3 days. She's home now, fortunately. But I took an Uber home the first night she was in the hospital because my car had gotten locked in the valet place at the hospital, and on the way home I was just sobbing in the back of the Uber. So that's a bit about my mom's cancer and my and kind of what I'm going through. So now I want to kind of talk about the advice I would give for anyone going through this. The first thing I would say is there's no point in asking why. Do not ask why. My mom did everything right. She walked 5 miles a day in hilly Pittsburgh, Pennsylvania terrain. She always ate healthy, never smoked, never did drugs, barely drank. She watched out for microplastics, and it still got her. So don't worry about if your mom or dad smoked or if they drank or whatever. Cancer can happen to anyone. Don't torture yourself trying to figure out why. But it would be good for you to talk to a doctor and ask if the cancer that your parent has is genetic. My mom's is not. I'm not at any risk of getting this cancer. Another thing is, I'm sure you're going to want to help your parent, and I'm sure your parent will need your help throughout this, but your parent needs multiple people. The saying goes that it takes a village to raise a child. It also takes a village to help someone get through cancer. You cannot do this by yourself. I just want to make that really clear. You cannot do this alone, and that's okay. It's time to start reaching out to your mom's friends, your mom or dad's friends, I should say, your friends, other family members, or anyone who will be able to help take your parent to appointments, make dinner for you, take care of other medical things like that for your parent, because not only do you need help with this, you deserve to have your own life at the same time. One thing that I was not prepared for when my mom was diagnosed was that I was going to become my mom's parent, and I was going to talk to her like she was a child a lot of the time, because sometimes she was so scared that she was acting like a child. And I don't mean that in a rude way, but that's the nature of cancer. And I have countless times coddled my mom, hugged my mom, let my mom weep into my chest and shoulders. I have held her hand through appointments with the doctors. I've spoken for her with doctors. I have said everything is going to be okay like you would to a child, and that was the most jarring thing for me out of this entire process. So be prepared for your relationship to shift with your parent. But at the same time, I expect that you will get a lot closer with your parent too. I was tight with my mom before her diagnosis, but we are inseparable best friends now, and there is much joy to be had in our relationship. The cancer only takes up a small percentage of our conversations. I mean, we are closer than I ever could have expected. Be prepared to see your parent in compromising situations. You will see them naked. You will clean up their bodily fluids. You will see them bleeding. You will see them crying. You will see them in pain that you can't stop. Prepare yourself for things like that. And remember that you will get through it, even if you're terrified in the moment. You will be okay. With all of that being said, remember one thing, that your parent is still a person. They're a human being with feelings, and don't forget, even if you get used to talking for them to the doctor, don't forget to get their consent for these things every time. Sometimes your parent may want to speak for themselves and other times they may not, but don't take away their humanity from them. I know you don't mean to, but it's easy for them to lose everything that makes them feel human during cancer. So try not to pile on to that. Speaking about retaining their humanity, Ask yourself and ask them, what can they do and what can't they do anymore? If your parent can no longer walk, maybe and the doctors suggest that they use a wheelchair, ask if they can use a walker instead. If the doctor insists on them taking medication that your parent does not like how it makes them feel, ask if there are alternatives. Be an advocate for your parent in the way that they retain their personality and humanity throughout this. Going through something like cancer, they're still going to have their likes and their dislikes, and try to prioritize them receiving their likes and not receiving their dislikes in this process. Another thing is you need to prepare yourself to put your foot down when your parent will inadvertently do something that hurts themselves. It's your responsibility to stop them. If your parent refuses to take the medication that will help them, you have to make them take it, whether you force them, whether you cut it up for them, or at worst call the doctor and say they're being non-compliant and that you need help. If they insist on walking up and down the stairs when they're too frail to, you need to stop them from doing that by blocking off the stairs in a way that they can't get through it. It's difficult. This is hard. This is not what any child should have to go through, but you need to do it for their own sake. It's time to repay them for all the help they gave you as a child. Throughout all of this, don't forget to put yourself first at times. I would highly, highly recommend finding a therapist if you don't have one. Almost all therapists will be trained in this sort of situation. Anytime you have strong feelings about something, whether it's seeing your mom vomit, your mom or dad vomit, seeing them in immense pain, getting new information about the prognosis, write it down, write that feeling down and what happened, and reference that list the next time you're at therapy. I start a new note in my notes app on my phone that just says therapy, and I just write down anything that bothers me throughout the week, and I look through it at my next session and talk about each item with my therapist. Another thing is, this is going to be hard. You are going to cry and you're going to sob, and you will sob yourself to sleep a lot of nights. You might be crying right now as you watch this. I want to say that it's completely normal. No one is ever prepared for this. No one is meant to go through something like this, but you're going to be okay, and you're going to get through it, and most importantly, it's going to get easier over time. It's not going to be easy ever, but it's going to get much easier. I highly recommend trying going to a support group. Go to at least one group. For example, here in Pittsburgh, there's an organization called Cancer Bridges, and they run a lot of support groups for cancer patients as well as their family. And also they do art therapy classes. They have one-on-one therapy. Finding a center or organization like that will be immensely helpful. If you need help finding one, comment down below, and you can either DM me or just put your info in the comment, and I'll try to help you find somewhere. Personally, a support group is not for me, but I'm glad I tried it, and I have personally found that one-on-one therapy is what works for me, but everyone is different, and you won't know until you try it. A great resource is the American Cancer Society. I utilized them at the beginning, and they have been incredible. I can't sing their praises enough. They do free consultations with 2 different avenues for anyone diagnosed with cancer or a loved one. So the first thing you can do is consult with a nurse and get more information about the type of cancer that your loved one has. The nurse will meet with you on Zoom and walk you through everything that the American Cancer Society and the medical community knows about that cancer, and they will help point you in the right direction for more specialty questions. But secondly, you can also consult with a clinical trial matching team. If your parent has no other options and there's no known treatment for the cancer your parent has, they will help you find a clinical trial somewhere in the United States or maybe even outside of the country where your parent can participate in experimental treatments for this type of cancer. I would highly recommend reaching out to them if you're uncertain at all about how to handle this. You don't even need to have medical questions for the nurse. You can just ask broad questions about how to get through this, how to handle it, what things are going to look like. and how to support your family member better. So that's all I have to share, but I guess I'd like to close this video out by saying, first of all, I'm so sympathetic and sorry for what you're going through, and I truly hope that your loved one gets better. I also want to say that my DMs and comments are open. Please leave a comment if you need someone to talk to, and it doesn't even have to be me. I'd be happy to talk, but it can be someone else, and I can try to find like a group or therapist or something for you. And just remember, the world feels like it's ending right now, but you're going to be okay, and you're gonna get through this.